Okay, all right. So hello, dears. Ayan. So we're now in the second part of our video on chemical exam of feces. All right. And now, we'll now start with the bulk na gyud of our lecture. Starting first with our first test sa chemical exam, and that is your occult blood. Again, as mentioned sa previous video, the occult blood testing is the most commonly performed gyud na chemical exam sa feces. Okay, so ang occult blood. All right. So again, what is occult blood? Now, any bleeding daw in excess of 2.5 ml per 150 grams of stool is considered pathologically significant. But this amount daw is not usually seen or no visible signs of bleeding with this amount of blood. That is why your FOBT or fecal occult blood testing is necessary. Okay. All right. Because again, bleeding. All right. Greater than 2.5 ml per 150 grams is considered significant, but dili niya siya makitaan in your stool, in the naked eye. That is why we perform this FOBT test. Okay. Now, why do we perform this? What is its significance? Number one is, of course, diagnosis of GI disorders. Because again, there are some disorders that can lead to bleeding that are just in small amounts. Example, kani, na dili makitaan. Okay. Routine physical exam, of course, because we want to detect ba if na bleeding para maagapan dayon. And ang pinaka-important, wala pa day, routine hospital testing. Some hospitals test this. Okay? All right. And number one good, pinaka-important yun is mass screening for colorectal cancer. Because again, I think one of the initial na mga symptoms na ma-produce sa colorectal cancer is bleeding. All right? That is why if nagani magpa-occult blood, usually, first disease good na pwede nimo ma-think about is colorectal cancer. Because again, this is prescribed by the American Colorectal Cancer basta Society, American something. Because again, this occult blood testing can be used as a screening test for colorectal cancer. Okay? Alright, ayan. So that's I think, sa significance niya, kanina ang pinaka-important. Mass screening for colorectal cancer. Ang occult blood testing. Okay, alright. Now, next, we go now for patient preparation. Of course, dapat na ay red meat-free diet. Why? We'll know later sa testing. Why dili siya pwedeng mukha ng red meat? Avoidance of peroxidase-rich food, still the same because of the testing later. Yung principle. Suggested diet, moderate amounts of food pa rin. And, muna siya for patient preparation. For indications, we have also hemorrhoids, diverticulitis, okay? Anal fissures, colitis, colorectal cancer. So why we perform occult blood? So indications could be or like diseases that can contribute to occult blood. You have hemorrhoids, the diverticulitis, anal fissures, colitis, and again colorectal cancer. Okay. All right. Now for occult blood, these are just examples of the FOB test formats. Ayan. So we have different tests. Good. We have benzidine test, orthotoluidine, guaiac, hema test, and your HemaScreen. Now, for your benzidine test, that's considered to be the most sensitive, okay? Most sensitive ang imuhang benzidine test, okay? But ang most preferred is your guaiac, okay? Most sensitive is benzidine, all right? Pero the most preferred is your guaiac, okay? All right. Iron spelling, guaiac. Okay. The guaiac test. Okay. All right. Why? So this is still the principle. It's actually similar to your urine blood reagent pad na principle. The pseudoperoxidase activity of hemoglobin. So again, H2O2 plus the chromogen. So kani mga benzidine orthotoluidine, muna siya yung chromogen. And hemoglobin, which serves as your peroxidase, okay, converts H2O2 to water, and at the same time oxidizing your chromogen to an oxidized chromogen, which is now a colored compound. Okay. All right. So again, benzidine, guaiac, orthotoluidine, these are again all your chromogens. Okay. Now, why is guaiac the most preferred? Because again, benzidine is really sensitive. So meaning, ma-detect niya bisag unsa. Alright? Na type of blood or hemoglobin ba na naa dito. So we don't want that. Okay? Para ma-avoid nat ang false positive. Okay? Alright. So that is why we resort to guaiac test. So, muna siya ang mas preferred. Okay? Pero ang pinaka-sensitive good is your benzidine test. Okay? And this HemaScreen test is usually, if sa lab pa nato unta, that's what we perform. Okay? And, HemaScreen test. Alright? So, muna siya itong i-perform unta sa lab. And some labs also use HemaScreen. But some of them use, I think, the guaiac test. Okay? Alright. Ayan. Okay, so we now go now to your HemaScreen test. So how is it performed? Ayan. So as you can see, HemaScreen siya. So kabantay mo sa yung picture. HemaScreen siya kay na siya screen and then imong ipahid ang stool dito. Okay? So as you can see sa drawing, di ba, na ay duha ka circle. So muna siyang screen, then imong ipahid ang stool dire. Okay? Alright. So ayan. So for the procedure again, we label a case with patient's information. Open the perforated, meaning katong meron gibuslutan daan na side. Pag open mo na ng duha ka buslot, alright? Okay? Again, ato siyang ipahid ang feces, alright? 2 test areas. And then, we cover it and then imo siyang ibali, alright? Sa pagbali pag yun, na another portion dito na gibuslutan. And then dito nato ibutang ang color developer, 2 drops, guaiac reagent on each of the test areas. Alright. And then after a while, we wait for 2 minutes and then we wait for a blue color na mo compare sa control. Alright? And if beyond 2 minutes na color na develop, we ignore the result. Okay? Because again, that's not considered significant na. Okay. So kaning duha ka is your test and this is the control. Alright? So again, this is one side, okay, of the HemaScreen. So imong ipahid ang attach there. Alright? And then pag human imong takluban, ibali na pod na pagbali nimo na apoy katong buslot na daan na cover, imong i-open, and then sa likod ani nila, ibutang nimo ang color developer. Okay? And again, ang positive niya is blue color within 2 minutes. Okay. After noting the result, do the same for the control or monitor the areas. Okay. Alright. Ayan. Again, interpretation, positive appearance of blue color after or within 2 minutes or after 2 minutes. And negative, no blue color after 2 minutes or any blue color beyond 2 minutes. So, dapat within 2 minutes lang yun. Or after 2 minutes, not beyond 2 minutes. Okay. Alright. So, example, like 3 minutes. Pagka 3 minutes pa siya ni blue, ayan. So, that's negative already. Pagka 4 minutes, ayan, negative. So, dili na siya, ibahalag ni blue siya na ng mga period, that's negative already. Okay. Alright. So, again, for occult blood, false positive, of course. False positive errors. Number 1 is avoid for 3 days. Ayan, red meat, melon, broccoli, cauliflower, horseradish, and turnip. Of course, red meat, that could, pwede na siya hemoglobin from the meat. Kay red meat man, so medyo na pa'y blood. Okay, so that could be falsely, that could react with your test. So, dili ang blood noon sa patient ang ma-detect. Okay? Melon, broccoli, cauliflower, horseradish, and turnip, they have their own natural pseudo-peroxidase daw or mga peroxidases, which again could cross-react with your test specimen. Okay? Alright, so dili na, it could not, again, could lead to false positive. And avoid for 7 days aspirin, NSAIDs, and other than paracetamol because these drugs can cause irritation daw sa GI. So pwede noong maka-cause og bleeding, alright, because of irritation sa GI. So pwede siyang maka-false positive. Instead na because of the bleeding is due to other diseases, pwede siyang because of these drugs noon due to GI irritation. Na-irritate imuhang GI. Alright. NSAIDs, guys, that's non-steroidal anti-inflammatory drugs. So, example, mga acetaminophen, mga ibuprofen, and so NSAIDs. Okay? Alright. And false negative is, of course, vitamin C, of course, and iron supplements containing vitamin C because vitamin C is a reducing agent, a very good reducing agent. Remember, in your urine gapon, vitamin C. So yung mga affected, mga BB lang, di ba? BB lang. So vitamin C, because again, it could cancel the activity of the peroxidase, right? So, therefore, false negative. And of course, if dili ka kahulat, di ka kabalo muhulat for the specified time after sample is applied, to add to the developer reagent. So, dapat within the specified time, imo siyang i-wait gyud para na ay result or na ay reaction na may tabo. Okay? Alright, so again, that's for occult blood. Usually used again for colorectal cancer determination. Unsa yung principle? Pseudo-peroxidase activity of hemoglobin. Wag na mag-isip. It's similar good sa imong urine na blood reagent pad. So, okay na. Again, most sensitive is benzidine, pero ang most preferred mo is guaiac. Okay? Alright. Ayan. Okay. Now, we go now to the next chemical exam, and that is testing for your fecal enzymes. Okay. Why do we test for fecal enzymes? Because these enzymes are contributed or ginahatag sa imong pancreas to the intestines for digestion. Okay. Now, if wala ka na enzymes, that could mean you have pancreatic insufficiency. such as that could lead to or that is caused by the different diseases, example, chronic pancreatitis or cystic fibrosis. And because of this, na steatorrhea, increase imong fats because again, dili ma-digest, and undigested food appears in the feces. All right. And the major fecal enzymes, we have 3, trypsin, chymotrypsin, and elastase 1. Okay. All right. So we now go individually to these different enzymes. We have, first is trypsin. Trypsin, again, for evaluation of pancreatic function and diagnosis of cystic fibrosis in children. We use the X-ray film test. So what happens is, ang trypsin niyang i-digest ang X-ray, munang na ay positive. Result niya is transparency or clearing of the film. And we have the gelatin digestion test. And the positive is the digestion of gelatin. Okay, so we'll have that, we'll perform usually this gelatin digestion test sa atong lab unta. Okay, all right. And we have chymotrypsin. It's usually for more resistant siya to chemical degradation. Okay, and it's more sensitive indicator. Siya ang sensitive indicator of less severe cases of pancreatic insufficiency. Because again, chymotrypsin, again, kung dili kayo inanaka-intense imong pancreatic insufficiency or disease, mas ma-detect niya. Mas ma-detect niya. Okay, so it's more sensitive. Chymotrypsin. And capable Japan of hydrolyzing gelatin. Okay. And usually we use spectrophotometry, di ba? In your clean chem, spectrophotometry ato ang tests for chymotrypsin. Okay. And last enzyme, we have the elastase 1. Your elastase 1 is considered to be the major or most strongly resistant good to intestinal degradation. So since it's really resistant to intestinal degradation, it's the more sensitive good for pancreatic insufficiency, regardless if it's major ba or like intense good na pancreatic insufficiency or kanarang ginagmayra. But again, if you were to choose between the chymotrypsin and elastase 1, you choose elastase 1 because again, it's the most sensitive indicator of pancreatic insufficiency. Okay? All right. And we do this using immunoassays. So with the use of antibodies, all right, or mga test kits ba, all right, or other immunoassays. In your second SEM, you'll learn about the different immunoassays. Okay. All right. Ayan. So we now go to the test unta nato i-perform sa atong lab is the gelatin digestion test. Unsa kanina enzyme ang gina-detect? Trypsin. Okay. So again, label, you put 9 ml of distilled water and add 1 grams of stool, 1 gram of stool. We mix to form a homogeneous na mixture or specimen. Place 1 ml in the vial and then 1 ml pod of sodium bicarbonate and gelatin. So we cover and mix and then incubate for 1 hour at 37 degrees Celsius or 2.5 hours at room temperature. And then after, we refrigerate for 20 minutes para atong lantawan if mugahi babalik ang gelatin. Okay? Alright. And ang interpretation, ayan. So ang positive for trypsin remains liquid and negative, the mixture solidifies. Okay? So it means, kung positive ka for trypsin, liquid gapon, so your pancreas is working well. Because again, you have trypsin. Okay? That could digest your different dietary proteins ba or what. But if negative siya for trypsin, then there could be a problem with your pancreas or with the trypsin levels. Okay? Alright. Because again, solidify man ang gelatin, murag wala siya na disintegrate or wala siya na digest by trypsin. Okay? Alright. So that's for gelatin digestion test. Again, this is one of the tests na atong perform unta sa atong lab if normal classes unta. Alright? Okay. Okay, next we now go to your, of course, steatorrhea. Okay, remember again, sa meaning sa steatorrhea, increased fats or lipids in stool. Okay, alright. Now, again, why do we use or why do we detect steatorrhea? It's because, again, still for pancreatic insufficiency and small bowel disorders, okay, that cause malabsorption. And we differentiate them through the D-xylose absorption test. Okay, so the D-xylose absorption test. So your principle, D-xylose is an exogenous substance, meaning imo pa siyang i-intake, all right? And this is not, it does not use the enzymes produced by the pancreas, okay? But it is absorbed freely into the blood. And after mo siya i-intake, mo-present siya sa urine. So therefore, if low ang urine D-xylose, it means na kay malabsorption problem. And it's not related to pancreas. So if low imo ang urine D-xylose, it's because you have a malabsorption problem. Okay, all right. So ang specimen nato is 5-hour timed urine kept under refrigeration. And ang results again, plasma level of less than 25 mg per dl of D-xylose, and urine excretion na gamay, that is due to malabsorption syndrome. Okay. High xylose levels in blood and urine, normal, okay, it's normal. Symptoms may be due to another cause such as pancreatic or bile insufficiency. Okay, so because again, you're experiencing steatorrhea, di ba? That is why we introduced D-xylose, because we want to determine if ang cause ba sa steatorrhea is pancreatic insufficiency or malabsorption. Okay, now if high mo hang urine xylose and plasma levels, then that could mean na normal ra siya. So katong symptoms mo na experience na steatorrhea, it may be due to pancreatic insufficiency. Nagets ra? Okay? It's not because of malabsorption. Kay taas raman imuhang xylose levels sa urine and blood. So therefore, nag-steatorrhea ka, it's not because of malabsorption, but maybe due to pancreatic or bile insufficiency. Understood? Okay, alright. So again, D-xylose test. Okay. And high levels ra in blood pero low in urine, it could mean na kay kidney dysfunction. Because again, wala siya na release sa kidneys. Okay? Wala na properly function yung kidneys. Taas siya sa blood pero wala sa urine. So wala siya na filter by the kidneys. So therefore, na problem siguro sa imong glomerular filtration or other function of the kidneys. Okay? Alright. So again, that's the D-xylose test. 25 grams daw of D-xylose. Okay? Ang i-intake orally by the patient. Okay? And then after 2 hours, okay, kuhaan siya blood to test its levels, and then 5 hours po after 5-hour time sa ihang urine. Alright? And again, malabsorption syndrome, unsa may mga other causes of malabsorption. Pwedeng bacterial overgrowth, meaning daghan na kaayong kagaw na nagpuyo sa imong intestine, so dili niya maka-absorb properly. Giardia lamblia infection, remember? Because again, your Giardia lamblia, because of its sucking disc, mutapot siya sa imong intestine. Therefore, dili maka-absorb among intestine og nutrients, right? So malabsorption. And Crohn's disease. Crohn's disease is like an immune disorder still affecting the absorption capabilities of your intestine, small intestine, okay? So that is why we differentiate malabsorption na cause sa steatorrhea from pancreatic insufficiency. Okay? Gets? All right. Ayan. Now we go now to again your fecal fats. So again, still for the purpose of diagnosing pancreatic insufficiency, steatorrhea. So for qualitative, we use the stains, your fecal stains or lipid stains. You have Sudan 3, Sudan 4, and oil red O. Now, again, we detect neutral fats, phospholipids, and cholesterol. Okay, so different types of fats. Okay, so for neutral fats, it's stained orange, red. Okay, and your neutral fat, ang iyahang composition is 95% ethanol. Okay, muna siya ang procedure. Plus the stained Sudan 3. Okay, Sudan 3. Alright. Sudan 3. Okay, Sudan 3. Alright. Okay. Now, for neutral fats, again, we look into the different fat droplets. If greater than 60, okay, 60 droplets daw per HPF, this could indicate steatorrhea. That's for neutral fats. Neutral fat staining. Unsay composition? 95% ethanol and Sudan 3. Again, unsay color? Orange-red or orange droplets. And then we look into it under the HPF. If greater than 60 droplets daw per HPF, that is considered to be steatorrhea na. Okay? Alright. Next, we have also what you call your soaps and fatty acids. Not stained, so we apply heat and acetic acid. This is known as your split fat stain. Ayan, split fat. Because again, we apply heat and acetic acid. And the procedure there is ang imong stool, okay, plus 36% of your acetic acid, okay? And, sorry guys, wala na ako na-memorize. And your stain na Sudan 3. Okay, alright, Sudan 3. Okay. Again, alright, okay, I see. Alright, so still the same orange droplets pa rin. Okay, alright. Ayan. It's not stained because again, wala pa siya ni-apply og heat and acetic. That's why we add acetic acid and walay heat dire, but apil ng heat ana para ma-absorb niya ang stain. Okay? And now na naana siya heat and acetic acid, ma-absorb na niya ang stain. That is why it's now color orange pa rin, orange droplets. Now for split fat stain, guys, different iyahang interpretation. So what we do is we measure ang iyahang size sa droplet. Okay? So, what you see is normal daw, 100 na droplets na ang iyahang measurement is less than 4 micrometer ba? Okay, tama. Less than 4 micrometer. Alright? Slight increase if 100 droplets, ang iyahang size is 1 to 8 micrometer. Okay? Alright? Ayan. And increase yun siya daw if nakita na 100 droplets na ang size niya is 6 to 75 micrometer. Okay. Alright. Ayan. So as you can see, 100 droplets, Jude, ang imong i-count. So that's for split fat. Okay? But again, wala ko ka-experience ani personally sa internship. So I don't know, Jude, the entire procedure. So these are all theoretical pa rin. So that's for split fat, soaps, and fatty acids. Alright. And for cholesterol, again, i-heat ra gyapon siya and then stain para mo produce og crystals. Remember sa imong i-heat gyapon na crystals, unsa tong characteristic? Na notched corners, di ba? Rectangular notched corners. Okay. Alright. Ayan. So this is for split fat. Normal, if 100 droplets, ang size niya is less than 4 micrometers. So example, like 3 ra, 2, 1, and ana. Okay? Alright. And then slight increase if 100 droplets, ang size niya is 1 to 8 micrometer. Okay, so usually I think greater than 4 na. Alright? And increased ra if ang 100 droplets niya, ang size niya is 6 to 75. So mas dagko na ng mga droplets. Okay? Alright, ayan. So next, for quantitative is your Van de Kamer titration. So recall yung titration, di ba? We use again 3 days to sample. Muna siya katong may butang sa paint can, sa itong baho kaayog yun. Alright. And uses NaOH as your titrating agent. And phenol red as indicator. So titrate ka, so until na ay color na ma-produce. I think red Japon kay phenol red man. So ang ma-produce na color. Okay, di ba? So that's equilibrium na. Alright? And normal values is 4 to 6 grams of fat per 24 hours. Normal. So therefore, if greater than 6 grams of fat, then that is considered to be positive for steatorrhea. Okay? That's for fecal fat determination. Alright. Okay, ayan. Next, we also have your fecal leukocytes. Now, we detect fecal leukocytes, not really chemical, but more on microscopic ni siya. Pero ako nang gyapil. So, fecal leukocytes is usually used for diarrhea, detecting diarrhea. Alright, or other infections that could cause the appearance of your neutrophils or white blood cells. Okay? So again, feces, conditions that affect the intestinal mucosa such as ulcerative colitis and bacillary dysentery. So still mga bacterial infections pa rin. Okay. So for determination, we have 3 methods. You have one is wet prep. So 1 drop of liquid or stool or mucus plus 2 drops of low fluorescence methylene blue. For dry prep, stool plus Wright or Gemsa. So, imo siya ipaugasa and then i-stain mo siya Wright or Gemsa stain. And number 3 is lactoferrin latex agglutination test. So, we detect lactoferrin using an agglutination test. So, immunoassay, alright, detecting lactoferrin which is a secondary granule released by neutrophils. Okay, sa inyong hema na siya, di ba? Lactoferrin, a granule released by neutrophils against mga bacteria. Alright, so we detect lactoferrin using an immunoassay latex agglutination test. Okay. Alright. So for results, again, if greater than equal to 3 neutrophils per HPF, it could indicate an invasive condition or bacterial condition na intense ang effect kay daghan mang WBCs na ma-produce. Okay? And we have diarrhea with WBCs. So these are the bacterial pathogens that could cause diarrhea na WBCs. Of course, Salmonella, Shigella, Yersinia, enteroinvasive E. coli, AEC, EIAC, and Campylobacter. So usually, these are mga diarrhea na ay WBCs. Now, if without WBCs, toxin-producing, of course, S. aureus and Vibrio cholerae, because again, toxin naman, dili jud ang kagaw mismo. So, walay WBCs na makitaan. Viruses and some parasites also. Alright? Okay, so, maybe na ubang mga WBCs, pero they are not neutrophils ang makitaan. Alright? Okay. Ayan. So, here's an example of your picture. So, this is, I think, wet prep kay color blue man. So, low fluorescence methylene blue. Okay? Alright. Ayan. So, that's for fecal leukocytes. As you can see, di siya chemical. More on microscopic siya. Alright. Okay. Ayan. Now, we go now to other chemical tests that are commonly performed for feces. Number 1 is for carbohydrates. We perform the Clini test. Remember, sa Clini test, so katong tablet test. Still the same, copper reduction, di ba? brick red color ang positive. So why do we perform carbohydrate test? It's usually for lactose intolerance testing for usually sa mga babies daw or sa mga pediatric patients or infant diarrhea caused by lactose intolerance. Okay. Next, you have fetal hemoglobin. We use what we call the APT test. The positive result is solution remains pink. Now, what is the APT test? APT test, guys, is we detect if, because tama instances daw ng infant, makaswallow siya og blood, okay? Resulting to a bloody stool or vomitus, meaning iyahang suka. So we want to differentiate if it's fetal blood or maternal blood. That is why we perform APT test. So how do we do this? So ang infant stool, so muna mong specimen, or sinuka niya, vomitus, okay? Atong i-centrifuge, alright? Centrifuge, and then adan og 1% NaOH. 1% ba? Tama? 1%? Sorry guys, I have to, I think it's 1% NaOH. Alright? 1% NaOH, and then, because after that, we look into the supernatant. Alright? And because your fetal blood, okay, or hemoglobin F, o diba? Hemoglobin F, it's resistant to alkali or resistant to NaOH. Therefore, muna ang positive nimo is, solution remains pink. Wala siya na lyse ang RBCs, alright? But your maternal blood, hemoglobin A, adult, it's susceptible or soluble sa imuhang NaOH, alright? Alright. That is why, if ever ang supernatant kay yellow, alright, na ay yellow color, alright, it's because of na lyse ang RBCs. So therefore, that's maternal blood. Okay, gets? Kung fetal blood na siya, the solution remains pink because again, your hemoglobin F are resistant to alkali or resistant to NaOH. Alright? And kung maternal blood ang naa dito, mo yellow ang supernatant because again, your hemoglobin adult or hemoglobin A is not resistant to alkali. So malay sa NaOH ang RBCs, that's why mo yellow ang imuhang solution. Alright? Okay. Or supernatant. Okay. Alright, okay, next, for the other test, we also test for your muscle fibers. Okay, so again, sa itong term na to, for increased muscle fibers in your stool, creatorrhea. Okay, because again, that could still indicate pancreatic insufficiency, kaya wala na digest ay muhang muscle fibers. Okay, alright, so what we do is the 10% aqueous or alcoholic eosin test. Okay, so how do we do this? Alright, so for the chemical test, again, the eosin test, we detect for the red stain fibers. So for patient preparation, your patient should include red meat. Okay, so mukha siya red meat because again, that's your source of muscle fibers, diba? All right. Next, what we do is we emulsify your stool, okay? And then adana natog 10% eosin or your 10% alcoholic eosin. All right. And then after we add the cover slip, okay? And then we let it stand for 3 minutes. Let it stand for 3 minutes. And then examine it for 5 minutes. Okay, so stand for 3 minutes. So again, after ani is, you add the cover slip. Oh my God, wala lang po akong ink. Alright, cover slip. And then, let it stand for 3 minutes. And then examine for 5 minutes. Okay, for 5 minutes. Under HPF. Under HPF, high power field. Okay, all right. Now, for your high power field, what we look after is for the undigested fibers. Okay, so ang imong mga fibers na siya different orientation. Okay, all right. So, na ba na dili straight, mga ganun, charot lang. So again, undigested fibers. Okay, so ang appearance sa imong undigested fibers, so example mo ni ang fiber, ang striation daw niya or kanang mga linya-linya, kay both directions. So, na ay vertical, okay, na po'y horizontal. Ayan. So, muna siya ay undigested. So, we look for fibers na yun, ani. That's undigested. Okay? Alright. Because we also have, kung partially digested na siya, okay, partially digested, ang fibers niya kay either one direction lang. So, si Harry, Liam, charot lang. So, kung partially digested, kay striation in one direction. So, pwedeng tanan kay vertical or pwede tanan horizontal. Okay? So, dili siya mixed. Okay? One direction na yun. Vertical or horizontal. Now, kung completely digested, kung complete, di ba? Kung completely digested, kung complete, alright, wala na siya striations. So, smooth na siya. No striations. Alright? Okay, so ang atong lantawan is kaning undigested. Now, again, if there are more than 10, tama ba? Alright, more than 10 undigested. More than 10, ani nakita nimo per HPF, then that is positive for creatorrhea. Okay, so again, that is seen in cystic fibrosis or pancreatic insufficiency. Now, cystic fibrosis, guys, if I'm not mistaken, cystic fibrosis is a disease of the exocrine glands. So, na siya problem sa inyong mga sa ducts. Sige siya release og mucus, sige siya release og kanang substances sa imuhang, basta na problem sa imuhang exocrine glands. Now, pancreas is one of your exocrine glands, remember. So, muna siyang, again, creatorrhea. If positive ka for creatorrhea, it could indicate pancreatic insufficiency because wala kay enzymes, alright, that could digest the muscle fibers and or cystic fibrosis. Okay? Alright. Next for mucus, we have the Hex test. Okay, so light green against a dark green background, so negative staining. Alright, so that's for mucus. Okay. Alright, and for the remaining, again, so bilirubin, Gemelin's test, green color. And Huppert's test, green color pa rin. And urobilin, Schmidt's test, red color. And Schlesinger's test, which is a green color. So I think, kani sila ng mga test, if I'm not mistaken, sa inyuhang chemical sa lecture, chemical exam of urine, mga classic chemical tests ni sila, remember, I think. So still the same chemical test put for feces. Alright, ayan. So basically, guys, that's the end. Okay, that's really quite a long lecture, no? So bayo-bayo ito na chika. So again, that's for chemical exam of feces, all right? So we're not after any more parasites here. We're just testing mga chemical substances and their clinical significances. And please remember again, a most commonly performed na chemical test for feces is your occult blood gyud. Why? Because again, it's a screening test for your colorectal cancer. Okay, and the other tests usually gina-perform na siya, special tests na to sila, usually not encountered na gyud. Personally, sa akong experience sa internship in the routine clinical lab. Okay, but if ever man gani i-request, then at least kabulo na mo. Alright? I do hope that's clear lang, guys. Again, we're almost done na gyud. This is second to the last. And in the next 2 weeks, we'll have the last pre-recorded lecture na gyud, which is inyong favorite, the seminal fluid analysis. Okay? Alright. So, yeah, that's it, guys. I do hope na lang may nakatunan. I do hope clear to siya, although medyo na yung mga medyo buffering siguro sa akong part. So, apologies. Alright? Again, if you have any questions, just chat sa atong group chat or PM me. And I'll see you guys on our next pre-recorded lecture, guys. Alright? So, have a great day and keep safe.